Hello everybody, I'm Dr. Hansen. The flu, also known as influenza, is a highly contagious illness that can occur in anyone. Every year, 200,000 Americans will be hospitalized because of flu complications. To put that in perspective, that's about 3 times the amount of people that will attend the Super Bowl this year. People who are at higher risk of complications include young children, pregnant women, the elderly, and people with chronic medical conditions such as asthma. Now, there are a lot of symptoms that you can get with the flu. Flu symptoms include fevers, chills, sweats, headache, muscle aches, fatigue, sore throat, runny nose, and a cough. The fever that you get with the flu typically lasts 2 to 5 days. Now, this is different than the fever you get from the common cold, which typically lasts a day or two. The weakness or fatigue that you get from the flu, that can persist up to several weeks. The diagnosis of flu is based on symptoms in a lab test that's done on a nasal swab. So when should you seek help from a healthcare provider? Well, if you have shortness of breath or difficulty breathing, if you have chest pain, if you have abdominal or belly pain, if you have so much vomiting where you can't keep down any fluids, if you have signs of being dehydrated, such as when you go to stand up you feel dizzy, or you're not passing urine as you normally would. Now you may wonder, when should I bring my child to seek help from a healthcare provider? Well, if the child has bluish skin, if they have both a fever and a rash, if they are very difficult to arouse from sleep, if they are so irritable where they can't be consoled, and if they're not able to generate any tears when they cry. One of the complications from the flu is pneumonia, and some people can actually die from the flu. So who's at risk of getting flu complications such as pneumonia and possibly dying? Well, this group includes children less than 5 years of age, especially less than 2 years of age, pregnant women, people 65 and older, people with certain medical conditions. This includes chronic lung disease, which includes asthma, chronic heart disease, chronic kidney disease, chronic liver disease, patients with diabetes, patients who have a weakened immune system, such as those with HIV or AIDS, or those who've had a transplant before. If you or your child has flu symptoms and are at increased risk of flu complications, you really should seek help from a healthcare provider. So let's say you're not at increased risk of flu complications and you're sitting at home with the flu. Now, you can treat the symptoms of the flu, but it's not going to make the illness go away any sooner. So 3 things to remember is rest, drinking enough fluids, and taking acetaminophen brand name Tylenol. When it comes to rest, you should rest until your flu is fully resolved, especially if it's a very severe illness. When it comes to fluids, you should keep in mind that you want to drink enough fluids to the point where you're urinating as usual, for 4 to 6 hours or so. Also, the color of the urine can kind of clue you in if you're dehydrated or not. So if your urine is yellow or clear, that's an indication that you're getting enough fluid. However, if it's tannish or a light brown or amber color, you're probably dehydrated. The third thing is acetaminophen or Tylenol. So this will take away the muscle aches, or help take away the muscle aches, the headache, the sore throat that you get. One thing to keep in mind is that children who have the flu or any viral illness and are given aspirin are at increased risk of a serious medical condition called Rye syndrome. So they should not be given aspirin. Children 18 years of age and less. Of note, cough medicines or cold medicines are usually not helpful for the flu. It's recommended that if the child is less than the age of 6, they should just avoid getting cough medicine or cold medicine altogether. Antiviral medications can be used to either prevent or treat the flu. These medications include oseltamivir, brand name Tamiflu, and zanimivir, brand name Relenza. The caveat to this is it's only effective if given within the first 48 hours of flu symptoms. If the medication is given after the 48-hour period of flu symptoms, then it has little to no benefit. Now, if given within that first 48 hours of flu symptoms, it will shorten the course of the flu by an entire day. Both of these medications can have mild side effects, which include nausea and vomiting. Zanimivir can cause difficulty breathing in some cases. Most people are able to tolerate these medications despite these mild side effects. It should be noted that antibiotics are not useful for the flu itself. Sometimes people will get the flu and then will have a complication from the flu with a pneumonia, and the antibiotics will treat the pneumonia, but the antibiotics do not treat the flu itself. Now, there are a wide variety of herbal, homeopathic, alternative, and complementary medications out there. However, none of these have been shown to be safe, and none of these have been shown to be effective. So which antiviral medication is best for you? Well, it really depends on the type of virus, if the virus is resistant, other individual factors, so it really should be a doctor to make this decision. Some people might wonder, what is the swine H1N1 flu? This is an influenza virus that contains parts of swine, avian, and human influenza viruses. It was first seen in Mexico in March of 2009. Human infections continue to spread around the world, causing a pandemic, which finally ended in August of 2010. Avian influenza is also known as the bird flu, and it infects mainly birds. However, there is an influenza avian virus, a strain called H5N1, that has caused human infection, mostly in Asia, which resulted in several deaths. These people were exposed to either birds or poultry, and that's how they got the virus. There have been no cases in the United States. If there were an outbreak of this avian influenza in the United States, the government does actually carry a vaccine in case it's needed. However, it's not commercially available. Thank you for watching my video. For more information or for questions, visit askdrhansen.com.